Hello, good day to you. Welcome to my channel. Okay, today I want to be talking about how to go about clinical based assessments in the hospital. So, if you are a student nurse and been allocated to surgical ward, for example, and you are being asked to carry out some certain procedures, there are some particular steps you must follow or you must carry out before any other steps in that particular procedure. So this ones I want to enlist now is also entitled to every other procedure you are doing, just like a normal routine. Like if you are asked to carry out a procedure for a patient, one, you must introduce yourself to the patient. You must seek consent from the patient, and you must explain procedure to the patient. So irrespective of the procedure you are asked to do for the patient, these three things must be done. And then fourthly, you must provide privacy for the patient. So you can't just, for example, they ask you go and prepare medication and do medication administration for patient bed 4. You won't just go ahead to just gather all your equipment where you have not talked to the patient. Patient don't know your intention. You don't know that you're coming to meet him or her. So if you are a student nurse and you have appeared before your supervisor, so what you're supposed to do is that you introduce yourself. Good morning, ma. I'm matric number so. So the supervisor will now reply, okay, please kindly do medication and kindly do sponging procedure for patient in bed 4. Then you now reply, okay, ma. Then you go straight to meet the patient in that bed 4. Because some supervisor can trick you. They might mention the bed number and ward, whereas there's no patient in that bed. So what if you go ahead and be preparing for that procedure, and at the long run there was no patient here? You just go and administer to empty bed. So that's why I'm going straight to meet the patient, introduce yourself to the patient, seek for consent from the patient after you explain procedure for the patient before you now go ahead to gather your equipment. Now, the aspect of gathering equipment now, you must disinfect your trolley. If it's trolley procedure, like Tepismony is trolley procedure, you disinfect your equipment, you clean your equipment, bottom and top trolley, then you remove the glove that you have used, you wash your hand, you dry your hand, then you put the items that's supposed to be at the top trolley. For sponging, you put 6 washcloths, the warm water jug, then at the top trolley, then temperature to measure the bath temperature to measure the temperature of the water you're going to use. Then the bottom trolley, you're going to put Macintosh recover, then 2 large towel. We're going to put it at the bottom trolley, then disposable bag. Okay, so when you gather all these things, then you now roll it down to the patient. If you roll it down to the patient, then number one thing you're supposed to do is to provide privacy for the patient. Use your screen. So you can use a standing screen to screen the patient, or maybe if the ward is actually demarcated, because some ward they have curtain already fixed there, you just draw the curtain to cover you and the patient to make sure there's privacy. Then you start the procedure. For sponge, you are using 6 washcloths. Okay, so patients, you first of all strip the top linen of the bed, the beddings. Then you now apply your Macintosh and cover with the large towel underneath. So you put it, you lay it on top. So you're laying large towel, Macintosh and cover on top. Then the patient will be on it, and then you remove the patient clothes to expose the area you're going to work on. Okay, so you're working head to toe because patient is having fever, pyrexia. So your intention to do tepispon is to reduce temperature of the patient. Okay, so you first of all apply, yeah, first of all, clean the face of the patient. After pouring your warm tepid water on the jug or bowl you want to use, then you wet one of the cloths you use to clean the face of the patient. Then the second towel, second and third towel, you're going to soak it and squeeze out small so for you not to be dripping water, and then you put one on the axilla, left and right axilla. So then the remaining two You're going to the two towel, you're going to soak it to and squeeze out a little water, put it at the left and right groin. Okay. Then while the other towel that is free, that's vacant, you can now use it to soak and then be doing a long stroke from the patient's body, like the hand, you do long stroke like this, then underneath like this, then the other hand you do long stroke and underneath. Then all those ones you put at the axilla and the groin. After a little while, you can interchange it, so you can remove it, soak again, squeeze, and then put it back, because after like a minute or few seconds, it is going to get warm. It's going to get a bit hotter. Then you now soak again in tepid water, squeeze, and then put again. So this procedure helps to reduce heat by conduction, evaporation, and the rest. So the body of the patient is still going to get a bit wet, so that air can still, there'll be exchange of temperature to the wetness of the body. Okay. Then when you're done with this procedure, you can now remove the Macintosh cover and then make the patient bed, and then you can as well change the patient clothing. But there are some precautions to take when you're doing tepisponging. One, if patient has tend to have vigor or is having chills in the process, you need to stop the tepisponging. When you stop it, then you cover patient back. You know that patient is not tolerating the procedure. Okay. Then if patient is having discomfort, is deteriorating or cannot withstand the procedure, you leave the patient, stop the procedure and leave patient to rest and report back to your supervisor. All right. Then there's also a procedure called cold sponging. The same way we have tepi sponging, we have cold sponging. Okay, it's just the same process, just that there's different in the temperature of the water. For cold sponging, the water is cold. While tepi sponging, the water is warm. So that's the difference between it. Okay. So let's talk about when they say take me round the world. Some supervisors will say, especially if you are the first candidate to start the exam, they'll say orient me to your word, take me round the world. It's actually a procedure. So what you are supposed to say, what you're expected to say when they say take me round the world, is that you introduce yourself, you introduce the name of the unit, say I'm student nurse Ngozi. This is surgical ward. It's a 10-bedded ward where we admit post-op cases of patient that has to be prepped for surgery, and then patient that is critical or fractured cases. So you mentioned the kind of cases that you're supposed to have in that ward. Okay, when you're done mentioning it, then you can start from nursing station where you and your supervisor is. This is a nursing station. We have 3 computers we use for documentation and patient care and records. Then we have about 4 nurses on today's shift. Nurse this, nurse this, nurse this. This is our HOD. Her name is this, that. Okay. Then let me take you around. Let's start from this. They always carry your supervisor along. If you are starting from general ward, let's start from general ward this way. Then you will follow you. Your supervisor will follow you. You say this general ward, it has 4 beds in it. General ward admits also category of patients in it. Patients that are have that can afford social amount for per night. That's why we admit here. Then you go to semi-private room, semi-private ward. You say this is semi-private ward. We have 2 beds in this ward because it's semi-private, it's not private. So, and this is a category of patients that we admit here. This is the financial status of kind of patient we admit here. Patient that can afford social amount. Then you can call the amount of bed charge in that place. Then this is private ward. You know, the private ward, patient that always want their utmost privacy, that don't want any other person to share room with them, we admit them here. Or this VIP room. Then, so you just be able to say that, okay? Then you can also, if you say how much, I can say activities that go on in this my unit, surgery unit are, we have wound dressing, we have nebulization, we have ward medication, we have infusion therapy. You can mention a whole lot. Okay, you can even specifically, if you have enough time, you can specifically say, oh, during wound dressing, we have different solutions. Then you can take the supervisor to quota they arrange your solutions. You know, in each ward there are some places we keep all the solution like povidone, iodine, spirits, Savlon, normal saline for wound dressing. So you'll be able to orient the supervisor in that aspect. Okay, these are the solutions we use for wound dressing. For diabetic foot, most times we use saw type A and B. Then for particular wound, we use this, that. So that's what you're going to say in that part. So is what you can do. Is what you can do. Okay, then let me talk about wound dressing. If you are to do procedure about wound dressing, please try and know the prescription the consultant in charge of that patient prescribed to be used for that wound. Some doctors may prescribe sulfatu gauze, normal saline, use saw. So depending on what the doctor prescribed for to be used for that wound, that's what you're going to use. You not go and do your own. So you just get to know the solution doctor prescribed for you to use for the patient, then you know the type of wound the patient is having, then you should be able to know if actually they prescribe the debridement of the wound or just a normal simple wound dressing. Okay, so when you get all these informations, then you go to your patient, you tell patient what you're going to do for the patient, they give you consent just like the way I've already oriented you. Then you now arrange your trolley, top shelf, bottom shelf, according to ways written in your procedure manner. Okay, you take it down to the patient bedside, then provide privacy, make sure you wash your hand, you wear a clean glove. Then wound dressing, you actually need a two-man procedure. You need an assistant, okay, to help be opening the sterile pack for you, be pouring the solution for you, be cutting this one, that one. So it's a two-man procedure, okay. Then as you are doing the wound dressing require face mask. So you can wear your face mask to avoid your saliva spitting into the wound or contaminating the wound while you educate the patient. Because as you are dressing the wound, teaching the patient wound, you can teach the patient wound healing process, diet, boosting of vitamins, and what can enhance wound healing. Okay. So always teach. Every time you have opportunity to care for patient, teach. Chip in some teaching topics. Okay. Then procedure is not fully complete if you do not round up like this. I will discard my used items according to hospital disposal process, like the domestic waste, hazard waste, and all of that. Then you will disinfect your used trolley, your equipment, okay, and sterilize. Then you will wash your hands and document. Document. Now for wound dressing, you're going to document even when you open the wound, you're supposed to assess the wound. Know the color, the exudate color that's coming out from that wound, the surface of the wound, if it is pinkish, reddish, or bleeding, gangrenous, and all of that. Okay. So along the line, a doctor might say take sample for culture and sensitivity. So if that is there, that's why you need to read the prescription of the doctor. So if you say take sample for culture and sensitivity, you're going to get a wound swab stick. Then you swab some exudate from it, then take to the lab, label, take to the lab for culture and sensitivity. Okay, so I think that is a wrap for that. Then which other procedure again? Carbolization, that yeah, carbolization is all about disinfection of the bed, the hospital trolley, or overhead table, but mostly of the bed. Okay, so carbolization we use different solutions. You can use jig, you can use Savlon like that. So you follow your procedure manner, how it is being arranged for you. Then one thing you should know as a student nurse, your procedure manner is your key, is your weapon. Everything you do, if they say you are wrong, please refer the person to your procedure manner. That is how it is written. That is how it is stated. Nobody will score you that if your procedure manner stated like that. So you just like your mirror. Okay, so I actually urge you to please get a partner. Read your procedure manner. If you say arrange equipment, there's column for equipment or procedure, surely procedure, trade procedure. Then what you need to do is to get all the equipment ready. Know which one is top trolley, know which one is bottom trolley. And before you arrange your thing, make sure you disinfect your trolley. Always disinfect and wash your hand. Okay. then put up trolley equipment, then button trolley equipment before you roll down to patient bedside. So I wish you all the best. Good luck. Bye.